I can hear you. Excellent. Okay, well, I'll just get started. I think because there aren't that many people here, so I'll just keep it really informal. This is a talk about inclusive research. I have a presentation, but feel free to interrupt or ask questions throughout the presentation. And if you don't mind, I've also got a short video which I'd like to show. Okay. Presentation. Can everyone see that? Sorry, I'm just trying to. Can someone let me know if you can see that? Okay.
Yeah, we can see it. Yes, we can see it.
God, it's been so long since I've done this. Okay. So hi, my name's Angela Henderson. I know quite a few people on here, but a few people I don't know. So I'm going to talk about, I've been asked to talk about inclusive research, and I'm going to talk about a project that we undertook at the Scottish Learning Disabilities Observatory, which was focused on including people with intellectual disabilities in research. And we did this through using a model of deliberative democracy, a method of deliberative democracy called citizens' jury, which we adapted to be more inclusive to people with learning disabilities. So to start off is really thinking about what does inclusive research mean. I think from sort of short investigation, really inclusive research is something that's developed in the UK probably towards the end of the late 20th century, alongside the closure of long-stay institutions where people with learning disabilities, when people with learning disabilities or intellectual disabilities were moved out from these hospital-based care settings into communities. And alongside that, we see the growth of the self-advocacy movement and calls for better inclusion, and the very well-known phrase in the disabled people's movement, which is nothing about us without us. So although the term was initially coined within the context of inclusion for people with intellectual disabilities, I think the term has become increasingly used to describe participatory approaches in other areas for participation with other groups of community groups. This definition that I've put here, it really relates to the inclusion of people with intellectual disabilities in research. So research, it's research where people with intellectual disabilities work with and as researchers, no longer objects of research, but active in the process. And I think for this project, we're really thinking about the whole of the research process and how we can promote and deliver inclusive approaches across the process of research, not just thinking about one small element within that process, for example, writing up or interviewing. So people with intellectual disabilities then experience major health inequalities, and they face many barriers to engagement in research, including in research that's specifically focused on intellectual disabilities, which attempts to identify, influence and address the specific health needs of this group of people. Having said that, whilst there are lots of barriers to inclusive research, there's still a very strong emphasis within research policy on the of all citizens in the research process. So I think it is imperative that we think about how we do this with people with intellectual disabilities. And from the perspective of the group that I work with, which is the Scottish Learning Disabilities Observatory, which was initially set up with funding from the Scottish Government through the Keys to Life policy, we were asked to work directly as part of our remit to work with and for people with learning disabilities and their families to ensure that their views and priorities inform the programme of work packages. So that's a little bit about the background and context for the work that I'm going to talk about now. So what I've mentioned that people with learning disabilities experience barriers to participation in research, and some of these barriers include attitudinal barriers. So we often find that that there's an assumption that people with learning disabilities don't have the capacity to be included in research, or that research with people that includes people with learning disabilities is unethical. So there are lots of different attitudes that I think act as barriers to inclusion. Clearly communication can be a really important barrier. So sometimes people with learning disabilities may need information given to them in more accessible ways. And this isn't necessarily something that's routinely done within the research processes and can be a barrier. So we might have a project that, whilst not specifically focused on the population with intellectual disabilities, but one that needs to be representative of the whole population. Theoretically, that should include people with intellectual disabilities. However, if materials aren't provided in accessible and multiple different formats, then it's unlikely that people with learning disabilities would be included or would be unable to go through the process of signing up to that study. There are also structural barriers to inclusion of people with learning disabilities or sorry, I keep changing between intellectual and learning disabilities. There are structural barriers. So those include, I think, a lot of the research processes themselves. So, and I think this doesn't necessarily just apply to people with learning disabilities, but getting funding for research, for example, can take a long period of time. And if we're looking at funding engagement right from the very start or at the inception of a project, we often find that we don't have the funding to support that engagement work before we've actually secured that. So, you know, there are costs associated with inclusion at the very early stages that maybe wouldn't be that researchers wouldn't necessarily have access to. But then there are other structural barriers as well, such as ethics processes. So often ethics committees can be quite a barrier to inclusion of people with learning disabilities. And then for the population themselves, people with learning disabilities experiencing inequality and exclusion. And I think often that leads to challenges in recruitment and selection and identification of people with learning disabilities specifically.
Angela, sorry to interrupt you. I'm not sure if you're sharing your slides.
Oh,
we've got the full PowerPoint, but it's not advancing. So I don't know if you've got it on presenter view, but that's not shared.
So how do I put it onto presenter view? Sorry.
If you unshare and then go back into share and then just select the window that's got your full slide on it, it should have, because at the moment you're just sharing your PowerPoint.
Huh.
I'm assuming you were advancing the slides, but
I am, yeah.
them, so.
Okay, so I've stopped sharing. Go to share screen. Yep. Okay. And then, sorry, everybody. Can you see that? What can you see there?
Yeah, so we can see your PowerPoint screen, which is not in share mode. So if you,
so that's what I did previously. So is there a different way?
So see, if you hit from beginning, if you just start, if you hit up there. There should be something, there should be maybe another option when you hit share screen.
Okay, it's not working. Yeah, I've been in a presentation recently where this was happening, and it gave me the option as a participant to move through the screens.
Have you got more than one screen?
Okay. Now it's just not working at all. Okay, is it okay if I just do it like this? Can you see what's on the screen there?
Yeah, no, we can see that. Yep.
Yeah, I don't have any animations or anything, so that should be fine. I'm going to talk about a specific project that we worked on at the Scottish Learning Disabilities Observatory. This project was funded by the Wellcome Trust, and the aim of it was to enable deliberation on intellectual disabilities health research at a conceptual, at an ethical and at a practical level, and to evaluate the viability of an adapted citizens jury method to provide insight into the views of people with intellectual disabilities specifically on health research, and to deliver recommendations to support inclusive public engagement in health research, and then to evaluate the viability of this method of deliberative democracy for doing research with people with learning intellectual disabilities. Okay. So I don't know if people have heard of kind of citizens juries, probably citizens panels is another very similar model, but all of these kind of come under the umbrella of deliberative democratic methods, or mini publics is another term that's increasingly used to describe these kinds of approaches. And for a citizens jury is a model of deliberative democracy that's trying to involve members of the public in decisions that affect their communities. So for us, this public was the population with intellectual disabilities, and they're getting sort of perspectives on research about the population with learning intellectual disabilities. So there's some core principles for citizens juries. They should be democratically representative, so representative of the community that they're working with. They need to encourage critical engagement with evidence, and to provide a space for facilitated, rigorous deliberation on the question, whilst drawing on the evidence as well. And the ultimate aim is that through this process of evidence, consideration of and presentation of evidence and deliberation, that the group reaches a consensus, and that's the ultimate output of a citizens jury, is really a statement or set of statements that everybody in the group can agree with. So for our citizens jury, we initially wanted it to be a Scottish-wide jury, but sort of practically that wasn't really going to be possible, and it in terms of the resources that we had access to. So we focused on one geographical area, which was the NHS Greater Glasgow and Clyde area, and we used Scotland's census 2011 to work out the demographic profile of the population with intellectual disabilities within NHS Greater Glasgow and Clyde in terms of age and sex. So that was really how we defined what our group should look like if it was demographically reflective of the population. So we had initially recruited 12 people to join the citizens jury, and eventually, once we started the process, 9 people were retained through the whole process, and of that There were 9 males and 4 females, and the age range was 16 up to 66 years old. And we were really keen that we recruited people that weren't people who previously worked with us, because often we find certainly within work and participatory work with the learning disabilities community, that it can be very easy just to go to the same people all of the time. So we were quite keen to spread the net as wide as possible. So citizens' juries are used and have been used quite widely, and across a range of topics and with a range of different communities, to consider complex issues that affect those communities. And for us, obviously, I've talked earlier about some of the barriers to engagement, and one of the main barriers to engagement really is communication and accessible forms of communication and recruitment and all of that. So we, in order to deliver an accessible citizens jury, we needed to undertake a number of adaptations to the process while trying to keep to those core principles of a citizens jury. Our recruitment was purposive and active. So we went out to organisations that provide support to people with learning disabilities, and we spread the net wide across all of those networks of third sector organisations, carer organisations, and independent advocacy or self-advocacy organisations. And we also included in the recruitment process people with learning disabilities to help us to develop the materials to make sure that they were accessible and understandable to people with learning disabilities or intellectual disabilities. We developed accessible materials, so all our information sheets, consent forms and minutes and everything, all of the tools that we needed to use to recruit and start to deliver this project was all in accessible, easy read format. So the topic for us was very broadly around including people with learning disabilities in health research, but we hadn't defined our question. So as part of the preparation for involving this group of participants in our citizens jury, we ran some capacity building sessions to help people who wanted to take part, to build their confidence for doing group work, to build their knowledge and understanding of research, of health research and communication skills, and also to develop that kind of group cohesion that's really important in group work. And trust between the facilitators and the group members. So that was quite an important part of the process, was just kind of delivering those workshops to help prepare people to take part in the jury. We had to, normally a jury would probably take quite a long period of time throughout a day, so meetings could be day-long meetings, but for us we were really aware that our group needed shorter meetings with lots of activities and breaks and chances to get up and walk about to enable people to maintain their focus. We also used other really well-tested methods of communication, one of which was talking mats, which is a kind of structured format for communication with people with intellectual and other communication difficulties. But also our kind of work to make sure that stuff was accessible. Also, we had to provide support to our expert witnesses who were providing testimony to help them to develop and deliver a testimony that was accessible to our participants. So that was a really important aspect and adaptation of our approach. we didn't, as I said earlier, we didn't develop a question for the jury. We didn't define that. We wanted to talk through the preparation work. We wanted to talk to the jury members to help them to identify what the question would be, and ultimately for them to identify and to decide on what the question that the jury would ask would be. And also what was another important element, sorry, is the that we we secured funding to enable people to bring their supporters with them. So we had funding for support workers to attend alongside the participants, and transcribers and other forms of support. So we had quite a lot of funding available to help deliver those aspects, which is a really important part, I think, of the success of this project. So as I said, the jury developed their own question, which was, how can people with learning disabilities influence health research, including influencing what research is done to help people with learning disabilities and how this research is done. So there was as you can see, probably the majority of the project was spent really in terms of preparation, building up to this kind of 5-day jury. So the jury is where the 7 expert witnesses that we'd identified would come and present their evidence in order to address that question to our jury members. So we had 7 expert witnesses from around the UK who spoke about the health of people with learning intellectual disabilities. They talked about the kind of research that had already been done, what we know and what we don't know about the health of people with learning disabilities. We had a representative from a health research ethics committee to talk about research ethics and the role and potential barriers that ethics committees can place on inclusion of people with learning disabilities. We had someone talking about research funding. We had a self-advocate, so a person with learning disabilities who had lots of experience of working alongside researchers as a co-researcher. And we had a session on the inclusion of people with profound and multiple intellectual disabilities in research, and then another talk on the topic of mental health and well-being, and then abroad, because we're the Scottish Learning Disabilities Observatory, and a lot of our research is based on secondary data analysis, which I think brings its own challenges to inclusive approaches. We had a session on using information that's routinely collected by health and care services. So those were our expert witnesses, and we helped them to develop their presentations so that they would be accessible to our jury members. They presented those over 5 days, and our jury members were able to ask them questions and to probe them for more information. So I've got a video. So at the end of the project, following a process of deliberation, the jury developed a set of recommendations, really in response to that question and all the evidence that they'd considered. But rather than me telling you about those recommendations, I'm hoping that this video will work. Can you tell me if it does or it doesn't work? Can you see YouTube?
Yes, again.
Y eso me refiero, ¿no? Cuando yo estaba creciendo y yo les decía.
Sorry, I can hear someone talking.
You might need to share your sound if there's sound on the video.
Pero sé que me estás regañando.
So when you share your screen, there's a box you tick to share your sound.
Okay, right. So I'll just go back. Thank you for helping me with my terrible IT skills here. Is there's somebody who's talking who hasn't got their microphone muted? Could you mute your microphone, please? Thank you. Okay, share sound. Thank you. Okay. So
Observatory, and we were funded.
Nobody
by the
can hear
Wellbeing
that.
Trust.
I can't
We
hear that.
recruited 12 people from across.
Yeah, we
the
can. I can hear that over
background,
here.
Oh,
It sounds
can
really
you?
good. Yeah.
And then went on to form our citizen student.
But it's not full screen, is it?
There needs to be more information about the medication and treatment for people with learning disabilities.
More people with learning disabilities should be involved in health research as people who do research. Sometimes people with learning disabilities might do research on their own. Sometimes they can work with someone who does not have learning disabilities. People with learning disabilities might need more time, more help and more patience to do that. We have different experiences to people who don't have learning disabilities. Sometimes we might have a different understanding. It will give us a chance to prove you're wrong and stop you shutting us out. It will make research better.
People with profound learning disabilities and their families should be more involved in research. This includes research that uses information from health services. If no one gets involved in research, it will be the same old research to find out what it's like for people with profound learning disabilities.
There should be an organisation where learning disabilities should go to. To be involved in health research should be non-judgmental, be made up of experts and other people that families.
People with learning difficulties should influence how the money is given out to health research, and we can do this by being actively involved in the decision-making process and what research is funded and where the money goes, and also being proactive in making sure our voice is heard.
There should be information and choice about whether people with learning disabilities are flagged or not.
The word flagging means when a person with learning disabilities go to the doctors and the doctor puts a note on their file when they have learning disabilities. Researchers can use this information to find out about health.
Why is this important? To keep our independence. It is our rights and we should have control over our decisions and personal and health information.
There should be a campaign around the health of people with learning disabilities, awareness talks about how to make things simpler with us, change people's ideas with us. We should tell the government what we are saying. We can make posters and do the petition and get attention for the issue.
There is simply not enough information about treatment for people with learning disabilities.
Why is this important? This media do not do enough. There is not enough information about health. We have to do ourselves.
There needs to be more support and guidance for people with learning disabilities and the people who help them to learn about health and health research. We should be able to find out about health research in a way that is easy to understand information. Could be pictures, writing or adverts on the TV and radio. Some people might need to help and support to get information. There should be information for important people like mums, dads, carers, teachers, headmasters, doctors, nurses and hospital staff. There should be easy understand information in important places like schools, clubs, GP practices and hospitals. If people with learning disabilities understand more about health problems, we know what help we can get. Some people with learning disabilities cannot talk, so they cannot tell us when something doesn't work. So we need to make sure that the people who support them, like families or support workers, know them. People need information about their condition.
People with learning disabilities should be involved in research ethics committees. Why people with learning disabilities should be involved? Because it will give ethics a better idea what it is like living with a disability. Because people with learning disabilities can be part of committees and would have an important voice. People should be paid, but it might affect benefits and make people afraid to be part of it. Some people might want to volunteer just.
In 3 years' time, we'll meet again. We'll do another report.
I hope that it makes it easier for people to connect with the recommendations and the research.
Thank you. Could everyone hear that? Because I couldn't hear any of that. So I'll just go back to my presentation.
Yeah, I could hear it okay.
Right. Sorry, that was seamless, wasn't it? Okay, so as you could see, hopefully, from that short video, that the work with the citizens jury delivered 10 what I saw as highly relevant and really well-reasoned recommendations covering quite a wide span of the health research process, from thinking about dissemination of outputs to providing accessible information to people with intellectual disabilities and their families around health and the outcomes of health research. But I think what really struck me from this project was also that there were important personal outcomes for people who took part in the process, both as jury members and people with intellectual disabilities, but also from the professionals who took part in as expert witnesses. So through our project evaluation, one thing we noted was that there was really high levels of improvement in self-reported confidence in terms of communication and knowledge of health research. So we did pre and post project assessments of people's own reflections on their levels of confidence for communicating in group settings, and also in terms of their knowledge of health research. So there was marked improvement there, but also from the point of view of the expert witnesses, a number of them said that it really encouraged them to reflect more on their own research practices in a really positive way, and that they got things out of the process that they didn't really expect to. So one of the jurors, for example, a quote here says that it was good, felt like part of a team or a group, because I don't get to go out to work. I really felt part of a team all together. It did good for my self-confidence. And then one of the expert witnesses said that the jury asked insightful questions, ones with emotion and personal experience reflected in the wording and thoughts. They made me consider areas that I hadn't really focused on. So at the very beginning of this process, what we wanted to do was think about methods of how we could better include people with intellectual disabilities in research and thinking about research. And we decided to use an adapted version of a citizens jury. And I think we found that people, when we looked at other citizens juries that had occurred, it was unlikely that people with learning disabilities would be representative in routinely in deliberative democratic processes, unless these specific barriers to participation were removed. But we also found through this project that with those adaptations, deliberative processes can be made more inclusive without losing those core principles that make them so effective, such as deliberation, representation, and the use of evidence. Finally, that when people with intellectual disabilities are given appropriate levels of support, we find that that they can engage in complex deliberation, and we witnessed that throughout this process. And as one of our jurors said, you can watch a football game, but playing the game is totally different. So as part of the process, we developed a number of resources which are all available on the Scottish Learning Disabilities Observatory website. We have done a number of blogs, a full evaluation of the project, which is available also on the website. And you can get access to to the jury's consensus report of recommendations. We've been asked to work alongside a lot of other groups as well. So members of our group have gone on to join other panels. We've also supported Southampton University to deliver a peer review citizens jury to consider how people with intellectual disabilities can be included in the peer review process. And we hope that this, through providing these resources, that we can continue to influence health research practice. And finally, if you want to know more about this project, we contributed to this excellent book, which is a very practical manual on how to do service user involvement with different groups of people, so not just people with learning disabilities. And we have a chapter on this where we describe the process that we did to adapt the citizens jury for this project. So thank you very much for listening to my presentation, and I'm happy to take any questions or if anyone has any, or comments or anything, or share your experiences. Ariane. Oh, I thought you had your hand up. Thank you. Just check the chat, see if there are any questions.
Hi, thank you very much.
Thank you.
Yeah, just a quick one. Are we going to get the slide just to get both the papers and the information on there?
I'm happy to send out the slides, yes.
Okay.
I'll ask Georgia, who's organised it, to send out the slides.
All right, thank you very much.
Sorry, I'm just looking at the meeting chat. Watana said that I'm confused. Do people with learning disabilities only mean people with intellectual disabilities, or do you include other disabilities such as autism, ADHD, dyslexia? I'm really sorry, Watana. I think I have been a little bit confusing with my jumping between learning disabilities and intellectual disabilities. So in the UK, when we talk about learning disabilities, we mean people with intellectual disabilities. So the term intellectual disabilities is used internationally in an academic context. We don't routinely include people with autism, ADHD, dyslexia, which would be referred to again as learning difficulties. So apologies if I've confused things. We are talking in this presentation about people with intellectual disabilities. Does anyone else have any questions? Any comments? Want to tell us about your experiences of inclusive research?
I was just going to say thanks very much for your presentation. It was really interesting, and I think it's a model that I would really like to know more about. That's one of the things that we're trying to do with a more neurodivergent population, so not necessarily around learning disabilities per se, but more about what was described earlier about autism, ADHD, etc. Just to try and hear voices.
Do you work in, Jason?
I'm in the what group do I work in? Mental health / ACEs Centre, whatever it's called, down the bottom of level 2 now in Clarice Peirce. So But one of the things that I'm really keen on doing is trying to hear the voice of neurodivergent people that isn't always necessarily the voices that we hear. So I was really struck by what you said was, we've always got this kind of group of people who are very vocal and present their own ideas. But I'm not convinced how representative that is. So finding ways to get representative feedback, I think, is really helpful. It's not something I've heard of before, so I think I'll look into it a bit more.
Yeah, it's definitely a growing area, sort of deliberative democracy, mini publics, citizens jury is just one example of that. And there was a recent report published by Scottish Government. I'll actually ask if you email me after this, I can send this to you, which was reflecting on a citizens panel on how to improve inclusion in Scottish parliamentary processes, and they used a citizens panel to do that. So they've got some interesting reflections on including other groups out with learning disabilities. Quite interestingly, they didn't include people with learning disabilities in their citizens panel. Evie, you've got a question. Can I come to you?
Yeah. Hi, Angela.
Hi,
thank you very much. That was really interesting. I would be interested in hearing a bit more about any challenges that you faced throughout this process, perhaps, if any.
So I think one of the main challenges early on was in recruitment of participants, as it always is, but just sort of that whole sort of goal of trying to get people who'd never really been involved in sort of self-advocacy previously. I mean, some of the people we recruited had experience, but we wanted to get a mix of people who weren't directly involved in sort of any kind of democratic deliberations. So we went to care organisations and quite a wide variety of organisations, but particularly the care and support organisations were really reluctant to pass on information to people, and almost sort of said offhand that, oh, nobody here would be interested in that, rather than giving people the opportunity and supporting them to think about. So recruitment was a barrier, and that comes down a lot, I think, certainly within our group of people that we're working with, is those attitudinal barriers that people with intellectual disabilities can just be routinely dismissed as not having the capacity to be involved or the capability to be involved. So that's always really problematic. Time we could always do with more time. We were really lucky that we got to do this work just before to complete the work before the pandemic. Because we were able to meet face to face. I think if we weren't able to do this work face to face on a regular basis, then it would have been completely different. The group because we had that time and physical space to be together, the group developed bonds with each other, which I think were a really important part of the whole process. So yeah, but I think for us, we were really lucky that we got funding from the Wellcome Trust, and that enabled us to, to recruit a project worker who was dedicated just to doing this work, because there's a huge amount of support involved in terms of planning people's support to participate. Really practical things like making sure everyone had the right kind of food to eat on the day, and that taxis were arranged, people knew how they were getting here and how they were getting home. We sent reminders before each meeting to make sure that people turned up. So yeah, there was a lot of logistical support we needed, and that really demands resources. So I think it's really, really difficult to do this without a dedicated resource, and it's difficult to get funding for this kind of work. So yeah, thank you. Any more questions, or do you want to come back on that, Evie? Are you doing any inclusive work at the moment? Or
we just completed, actually, I saw that Sophie is also attending this, so we just completed the realist review. And we try to involve actually people with intellectual disabilities. Yeah.
Oh, that's great. So how many people did you involve?
We had a PPI group of 5 people, including a support worker. And I also found that it was really important to have a support worker involved in the process.
But equally, I think having a support worker there is really important, but also I think it's important that they're not the participant, and sometimes I think we found that you're kind of trying to be quite tactfully explain to the support worker that, you know, it's not their views.
Yeah, exactly. Yeah.
But yeah, so
it was, I don't know, for me at least it felt like a sort of mediated PPI.
Yeah, it can often feel like that, definitely. I think there's a lot of work to do, but I think for us, I think the big lesson is that it does need a dedicated resource and staff. So we had a you know, we're lucky because of everyone in the observatory was able to help, and we had partnership with Talking Mats, so they were also involved in delivering it, and then Ryan McLean, who we recruited to participate to be the facilitator and project lead for the project. So it was really good having, you know, that dedicated person who was just there to facilitate that engagement, but usually it's an add-on to the work of the researcher. So, but there's loads of resources on our website if you want to look, and lots of tools, and I think there's lots of the learning from this project that can be transferable to other groups. So we're not just talking about people with learning disabilities. I think, you know, the tools and techniques could be applied quite widely. And the report of recommendations is a really important output from this. So I think really encourage you to go and look at that, the recommendations from the group on research and involving people with research. And one of those recommendations was about having a campaign to improve awareness and address stigma and discrimination experienced by people with learning disabilities. And that was something that was taken forward by our group led by Debbie Kinnear through the This Is Me campaign, which you may have heard of. So again, there's lots of resources and videos online on our website about that project as well, which was a direct outcome of this work. So, but I'm happy to take, you know, if anyone wants to just get in touch and speak to me afterwards as well, I'd be happy to talk to you about it. Sophie, you had your hand up.
Yeah, sorry, really interesting presentation. So I heard a bit about the project before, but not in as much detail. So in the video, you're talking about including people with profound intellectual disabilities, and I was just wondering how you managed to do that, and how would you recommend for future research projects to do that?
That's an excellent question, Sophie. So we considered that very early on in the process. So, and it was really, so we considered lots of different methods. In the end, we went through speaking to PAMIS, and PAMIS, for those of you who don't know, is the organisation that supports families and people with profound and multiple learning disabilities. So we talked to them a lot about planning how we could actually meaningfully engage with people who maybe don't have, can't speak or don't have speech, and to participate in the work. And we developed a kind of parallel process. So we had a few meetings where people with profound and multiple learning disabilities and their parents or carers came together to discuss the question and come up with their own sort of views and ideas. It wasn't part of the jury itself, and then we fed that back into all of our deliberations with the jury. So it's not perfect, but I don't really know sort of alternative ways that we could have done that. But I suppose we were trying to ensure that through all of our discussions, we considered the voices of people with profound and multiple learning disabilities. I don't know if you've got any ideas how we could do that better, Sophie?
No, I think the way you've done it is probably, it sounds like the best way to do it from my experience. But I was just wondering how you managed to, because in the sort of work we've done, it tends to be people with mild learning disabilities or intellectual disabilities, and obviously that can be a major limitation and a drawback. Yeah, I think a lot of research and inclusive research can not be honest about, you know, that it's a subset of the population with learning disabilities that we're doing engagement with, and it's not reflective of what is a very diverse group. Okay. Is there any more questions? Anything anyone else wants to say? I'm trying to see if I can see any hands. Nope. Oh, thank you, Debbie. Okay, well, if that's it, then thank you very much. And you have my contact information is on the presentation, so I'm happy to send the presentation out, or pop in and see me, because we're all in Clarice pairs now, which is great. So thanks. Bye. Nice to see you, Evie.